Okay, for this video we are going to be going over intramuscular injections. So when you obtain the doctor's order, before you go into the patient's room, you want to gather all your supplies. So I have gloves, I have a IM needle, and I have alcohol swabs to clean the vial and the patient. And you're going to want to wash your hands before you start to drop the medication. You want to check that you have the correct medication 3 times in the administration process. Once when you remove the medication from storage, once when you are getting the medication ready, and once when you are right before you give it to the patient. And you want to check the expiration date on the medication to make sure that you do not give the patient expired medication. You also want to ask if they have any allergies to the patient, or you want to ask if they have any allergies to the medication before you give the injection. And before you administer the medication, you want to follow the 6 rights. So you want to make sure that you have the right patient, the right drug, the right dose, that you're giving it at the right time, the right route, and right to document. And so we're going to walk into the patient's room, or we're going to first get the medication ready. So what you want to do is apply your gloves after you wash your hands. And we're going to clean the top of the vial. Gently for that to dry. And the correct needle gauges for IM injection is 19, 20, 21, and 22 needle gauge. And the needle's length is going to be 1 inch, 1.5 inch, and 2 inches. And here I have a 22 gauge 1 inch needle. And you want to draw up the amount of air that you are going to replace. So we're doing 1/2 of a milliliter. And we're going to inject it into the vial and put that air in there. And then we're going to withdraw the same amount that we put in there. Okay. And then you want to make sure there's no bubbles in there. And I'm not going to put the medication in the patient, or in this little arm dealie. And then once we go into the room, we want to introduce ourselves in the procedure, make sure they don't have any allergies, and we want to use 2 patient identifiers. The correct sites, or we're going to wipe down the patient, clean the injection site. The correct injection sites for IM injection is going to be your deltoid, your dorsogluteus, your vastus lateralis, and your ventral gluteal. And once we have the alcohol air dry, you want to grab the skin and you want to administer the medication at a 90-degree angle. And so we're just going to go straight down in a dart-like motion. And I'm not going to push down the medication, but you push it down and not all at once. You want to go kind of slow. And go ahead and take it out. And then you want to reassess your patient, like take its vital signs and all that good stuff after you get each medication, just to make sure that they're not having any adverse effects and that the medication is actually helping them out instead of making them worse.